The hospital is closing. We don't have a set date yet, but I'm assuming within the next couple of weeks it should be definitely shutting down. And so we're slowly closing units, discharging patients, and transferring those that we can transfer to other hospitals. St. Vincent's is a community hospital that's been here it's been here for approximately 160 years. We're closing because we've hit a pretty bad financial situation. We had approximately $750 million in debt, and we were no longer able to survive on our own. We tried having potential sponsors, and nothing came through, nothing panned out. So now we have no other choice but to close our doors.
How is it affecting you personally?
I'm being laid off, just like everybody else in the hospital. We're all looking for jobs. Like I said, we don't have a set date in which we will be unemployed, but we've gotten warning letters, or it's coming soon.
Okay, I've been a community resident for over 30 years in the West Village. I've been a patient at St. Vincent's maybe 4 or 5 times, twice for emergency services where I don't know what would have happened to me if I didn't have those services immediately. I've had neighbors who've come here for emergency services. I know old people in the community who use St. Vincent's. I know people who use the AIDS clinics and all the other programs that St. Vincent's has offered over the years. I can't bear the idea that a developer, because they have more money than community people, will take over this hospital and destroy it. I don't know why something can't be done to save the hospital. A hospital is an enormous, important piece of our community. Many, many people live here with children. There are families here. Most of us have lived here all our lives. We love this community. We love this hospital. My question is, why can't President Obama understand that the banks that needed those bailouts really didn't need it as badly as a hospital needs it? Why can't he be here helping our hospital, help bail out this hospital and this community?
Initially, Patterson was very actively involved in helping us try to stay open, and so were a lot of the other council members of the city. They tried, but it just wasn't enough. What do the people feel? Some people feel that not enough was done, and others feel that what could be done was done. It depends who you ask.
What do you feel?
I feel with the amount of debt that we had, I don't think there's any amount of political clout that could have gotten us out of it. Unless the state was willing to absorb our debt, and that's a large amount of money to absorb.
Well, the reason I'm going to President Obama because I feel he's the only one who has a heart. I feel our mayor doesn't, and I feel our governor, forget about it, totally, couldn't care less. The West Village is being destroyed by developers. Everywhere you look, the wealthy are coming in. We have just lost, when I moved here, we had 4 Chinese restaurants. We now have none. They've become banks. The old people have nowhere to go and eat anymore that's affordable and reasonable. I just heard yesterday on Hudson Street that a beauty parlor's rent was raised, get this, from $9,000 to $30,000, and they've just moved out. What is going on in our city? So don't ask me about Bloomberg, don't ask me about Patterson, because my answer is they've done nothing. It's all about the developers and the money, and it's a very, very sad thing. We have a beautiful city.
They haven't told us exactly what's going on. Only because we're employees, they really don't want to tell us anything. And I think a lot of it just has to do with the fact that we are pretty much a private institution. We're the last Catholic institution standing of our kind. They closed every one of the other ones down. And, you know, I really just think that they just don't care. Our government system, our mayor, doesn't care.
You know, we owe like over $700 million, and I feel that the hospital shouldn't be closed because we give to the poor, we treat the poor, we treat the needy, and I feel I emailed President Obama and asked him to help because he bailed out car companies, banks, he passed his health care, and what about us? What about our patients? This isn't just a place to come to work. This is a place where the doctors and the patients become very familiar with each other and feel very comfortable with each other. And they come here and they feel at home. They get personal treatment. They don't just get a prescription, a Band-Aid, and sent home. And I feel that after 160 years of giving charitable work, Mayor Bloomberg, I'm embarrassed to call him my mayor, or the mayor of City of New York. He hasn't shown his face. He hasn't helped. All we hear is that the city is not going to bail us out, which I feel since 9/11, we were here. We were here. We never turned our backs, and I feel that now the city needs to be here for us.
It breaks my heart that we have to close a hospital here in our neighborhood or anywhere. I mean, we can send troops to war and murder people overseas, but we can't take care of people in our own country, and that's really depressing. What can I say?
What explains that failure?
I don't know what explains the failure because it's usually about politics and Republicans. So that's all I can say. I don't know. But we shouldn't have to close a hospital here and put people in jeopardy in our city. I mean, everything is falling apart.
I feel that Bloomberg is all about just building high-rise and expensive housing.
Because that's what they want here.
Okay?
They want high-rises.
They want
condominiums.
high-rises. And if Bloomberg builds a high-rise here, I will be protesting his ribbon cutting. Anything that goes up other than saving the hospital, I will protest it.
That's why nobody's helping them, because this is prime property. And that's why you see nobody helping them, nobody coming to the aid of the hospital.
Nobody, no politicians, they
No
better
one.
not come in near me.
Definitely.
And
She's
that
100% right.
great-great-grandson should drop dead. And every one of these CEOs in here should be, books should be opened and go over the books.
Exactly right. They all should be in jail, all of these board of directors.
You gonna print it? No.
You believe me, they knew 6 months ago that this hospital was in trouble.
And not
They knew a
one
long time
politician.
ago.
They never
Not
mentioned
one.
it. They were in trouble. There was a lot of money, almost $1 billion, and nothing was mentioned to the end.
I've been here for 20 years. 20 years, December. You're gonna tell me that year after year you're not looking at your books and all of a sudden out of the blue we're in this trouble?
Last year we were actually talking about building a new hospital, and now all of a sudden, within the last 6 months, you know, the whole staff became aware that we were in dire financial constraints, and yeah, so.
We go to the town hall meeting and everything, but everything is just going around in circles. Everything just goes right back to the beginning, which is they don't have no answers. They can't give you anything. Even when everybody was interested in seeing the hospital, they didn't give us what hospital was interested. Everything was confidential. I mean, yes, there was a big meeting here, and we feel that there's even something going on that needs to be investigated, because this guy, Richard Daines, that works for the Department of Health, he is a former employee of Continuum. And what a coincidence, he works for the Department of Health. And Mount Sinai tried twice to make an approach to buy this building, to buy the O'Toole building, and it's been a block. And it's been coming from the Department of Health. I mean, this guy's a Patterson employee. Once Patterson is out of office, he'll be right back in Continuum. It's like, I don't know, it's just like I feel Continuum has something to do with this somewhere in the picture. And things need to get investigated here, because it's sad. I mean, this is not just a hospital. When people come here from generation to generation, there's people that come here and they talk to you about their problems, about their situations. It's more like a family atmosphere amongst employees and amongst patients. It's a relationship, and it's kind of sad that they will let an establishment like this just go down. You know, where's the morals and the values these days?
I'm helping to handle outreach on behalf not of the hospital, but of the doctors here, who feel that they need to take a stand, and they feel they've been subject to mismanagement of the hospital, as well as the fact that there was a deal in the works, that there was a good partner ready to take over this hospital, Mount Sinai, and they were pushed back. They were prevented from making the purchase. They're not sure what happened here, but clearly that there were phone calls from the Department of Health that prevented this from happening. And in fact, the head of the Department of Health was previously the CEO of Continuum, a company that was not slated to be making the purchase. So we feel there's some strange, funny business that's going on here, that the people of this community, the patients of these doctors, and the Lower West Side in general is getting the short shrift here, is going to get hurt. And to quote one of the doctors, Dr. David Kaufman, people are going to die as a result.